Hello everyone, welcome to Naturekids Parent Talk. I'm Aznida Azhar, the co-founder of Naturekids in Jalan Berhad. We're at Naturekids Childcare Center now. We are going to talk about oral health with our special guest, a dental surgeon from Pristine Dental Center, Dr. Suraya. Can you introduce yourself?
I'm Dr. Suraya. Thank you for having me, Puan Nida. I started looking at people's mouths for the last 20 years.
Our topic today is raising healthy smiles, oral care for growing children. Okay, so my first question, going to the foundations first.
Okay.
When should a child have their first dental appointment? Is it really when the first tooth comes out?
Ideally, for me, I think it's good to bring them before the first tooth comes out. They may or may not remember it, but it's good to desensitize slowly. As early as 6 months is actually not so bad. And even though they don't have teeth, the oral care is literally the tongue and the palate as well.
Oh.
And there's a relevance to that.
Some parents think that baby teeth doesn't really matter because they fall out anyway. Why is this belief a risk?
Right, now, the fact that we have our baby teeth, they literally act like a blueprint. They guide where the first permanent teeth will be. If you lose them before it's time, so everything else will drift into that space and you lose that space. And then that's where the overcrowding or impaction would actually happen. That's the last thing that you want as a parent. And also, if let's say one tooth starts getting decayed, food gets trapped, then can affect the next tooth as well. And also, even if they fall out fast, it can affect their speech and confidence and smile. So you don't want that to happen.
You were telling me just now that the child should go even before the teeth comes out, right? So the baby wouldn't be able to speak still, right? So they are still learning how to speak. How do you suggest cleaning the mouth?
Right. No, at that point of time, all they do is literally feeding from either bottle or breast, from mom's breastfeeding milk. Now, contrary to popular belief, we're supposed to clean their palate and their tongue after they feed because milk is still sugar basically. Once it gets contact with in the mouth, if you don't clean it, it can end up with infection, like what we call dental thrush, oral thrush. A lot of moms may or may not know this. Once they get this oral thrush, it's actually a fungal infection. It usually starts from the palate and also the tongue, and then moms didn't know that, and then they transfer it to the nipples, and that's where they can get cracked nipples as well. Or vice versa, mom gets cracked nipples, and then the whatever bacteria, fungal infection gets transferred to the mouth. My suggestion is very simple. You don't wake babies up or even toddlers up when they fall asleep just to brush their teeth. Just take a clean handkerchief or a clean towel, damp it, and just wipe, and that's it with your small fingers. I think now they have the silicone brushes according to ages. You just use that, and they don't have bristles. They're just sort of like indentations, and then that's it.
Just plain water, tap water, sterile water?
Plain water is fine.
No need toothpaste or anything.
No.
Speaking about fluoride, there's a lot of mixed information online. Is fluoride safe for children, and how does it help protect their teeth?
Now, fluoride is completely safe for children. It's really good for you. It strengthens your teeth. Unless your children or your child is allergic to fluoride, then no. But there's always an alternative, but it's always highly suggested that you use fluoridated toothpaste.
How much toothpaste should a 2-year-old use compared to a 5-year-old?
2 and below, just a smear, like a grain of rice. And 5, 6 above, you'd use a pea size. Now, when to swap toothpaste, right? Children toothpaste and adult toothpaste. So the moment they get their first adult teeth, you change it straight away to adult toothpaste. And then when they change to adult toothpaste, you can actually start with also almost half a pea size because they might not get used to it yet. And then you slowly, gradually build it up.
Because on the box, they have stated that the ages that clearly, right?
Correct. It always stops at 6 because once you usually get your first adult teeth at about 5 to 6 years old, and then you already need the dosage like an adult.
Like an adult.
Yes, that's right.
5 or 6 years old, once your adult teeth comes out,
Yes.
you will change to the adult
Correct.
toothpaste. All right, noted. Moving on to the daily struggles. What are your top tips for parents whose children refuse to brush their teeth?
This is what I do with my nephew. Do the copycat. So I do first and open, and then literally you're emulating tell, show, do, and that's it. Might be a while, but you'll get there. Second one, now the fact that we have YouTube, which is great. This is one thing that you can put into advantage. Do the YouTube music, open your mouth, and then you do. Now this is where you might really struggle for those who really hit anything in their mouth. We do a knee to knee. So can I show you?
Can?
Especially with toddlers, babies. So your knee faces my knee, and you would have your partner or someone. If you're brushing, make sure their head is here, right? And then their feet is here. If, let's say, they're struggling, someone can just hold their hand just for a bit. You cannot do this for too long because it can be quite traumatic, but sometimes you really need to brush. The most important one is at night. This is, if you have to do this, you have to do this for a bit.
Okay.
Just brush a little bit quickly, and then that's it. Knee to knee is always good to support, but make sure your knee touches each other.
No need to gargle and spit it out. No need. Okay.
Because remember, you're doing just a smear. It's actually safe. And what people don't know, actually most, the right way to brush your teeth is to spit and not rinse. You spit it out as much as you can. A lot of people actually treat toothpaste like soap, but it's not meant to be so. It's supposed to be like a lotion, a conditioner for your teeth, right? So if you just keep rinsing it out, it doesn't make any difference. Like you go mandi, right? And then you put lotion, and then you go
wash it off
again. It takes in its time for the fluoride to absorb. Usually after you brush your teeth, including ourselves and our children, wait at least 45 minutes, and then you can start drinking eating again.
Oh, that means the toothpaste acts as a coating to your teeth.
Yes, yeah, you absorb it, like literally like lotion.
All right, moving on. Besides sweets, what common toddler snacks contain hidden sugars that can harm teeth?
Number one, juice boxes. Yes. They're good, but I think the best would be cold press because they remove all the added sugar. And then even then, preferably you should dilute them and then use it with a straw. The dried fruits, they have a lot of hidden sugars. It's okay to have them as snacks, but limit it to maybe one big one, but not give a bowl where they can munch all day. And also any gummies like Haribos and whatnot, they are horrible.
That is a known sugar.
Even though they say vegan friendly or no.
Sugar free.
Sugar free, no. We can get sugar for something else.
At what age should parents be concerned about thumb sucking or pacifier use affecting teeth or jaw development?
Now, don't panic. Usually they would do this until they're about 3 to 4 years old, right? But let's say by the age of 4, 5, they're still doing it very often and very consistently. You can start bringing your kids to see a dentist. As long as they stop before the age of 5, 5.5, before 6, before the permanent teeth come through, then yes. We do have appliance habit breakers for those who are struggling.
How does it affect the jaw development?
A lot. Speech and teeth alignment. Pacifiers is not as severe as thumb sucking because with the thumb sucking, they really put a lot of pressure, and then you'll get what we call an open bite. It will affect speech. Chewing, when we say affects speech, when it's so protruded, they're more prone to injury actually, or also lip trap, so accidentally biting on their lip and things like that, and also confidence, really.
To be safe, 5 and 5.5 years old, you should stop.
The best would be 4 lah.
The best would be 4.
To be safe, because it takes a while to win them off.
That's right. Many children fall asleep with milk or nursing. Can this harm teeth, and how can parents transition to a tooth-safe bedtime routine?
Yes. Now, yes, of course, it can really harm your children's teeth and also the palate. Remember I told you, especially babies, children, maybe before 6 months, before the first teeth start, they feed on mum, right? That thrush thing. oral thrush. That's one. Number two, once they have teeth, again, essentially sugar. Milk is sugar. Once the saliva gets in contact with it, it will break down and literally sugar. And from sugar, it becomes acid. Now, when you sleep with any residue of, let alone food, but this is milk, it's purely sugar, it will break down the enamel, and you'll start what we call having bottle and nursing decay. I think we will put some photos later on and then show how it actually looks like.
Many children fall asleep with milk or nursing. Can this harm their teeth, and how can parents transition to a tooth-safe bedtime routine?
Number one, yes, it can be very harmful if you sleep with the bottle in your mouth or in their mouth, and also falling asleep with a lot of milk right after breastfeeding. And then the safest way to transition is to use sippy cup slowly. Limit the bottle maybe during bedtime or right before bedtime, and take it up right before they fall asleep.
Sippy cup.
Sippy cup.
You can lie down while drinking the sippy cup?
No, have them before they lie down. It's a good habit, and anyway, it'll get there.
Okay.
Slowly.
Just practice
Just
slowly.
practice, yeah.
Yeah.
It's just practice. You don't have to do it straight away. It'll take time.
Doctor, what are dental sealants, and do all children need them?
Fissure sealants, that's what they're called. They are amazing. It's like a holy grail for me. Now, they are really good for your teeth. You know how we have molars and they have deep grooves, all the little pits and fissures. They're really good for you. We're meant to have them. They provide friction for our teeth so that we can chew our food properly. But if they're some of them are quite narrow and quite deep, so we need to protect them. So if we don't, it's very easy for food or anything to get stuck in between because you can't clean them with your toothpaste. So we just seal them off. Think of it like a raincoat for the teeth.
If a child falls and injures a tooth or lip, what should parents do immediately?
Number one, you need to know if it's the baby tooth or the adult teeth. If you do know if it's milk teeth, for milk teeth, you just pick it up, but you don't put it back in. If it's adult teeth, you have to hold it by the crown and not the root. You rinse it under cold water and you dip it in straight into milk, and you go see the dentist. If you are brave enough, if it's adult teeth, you just put it back into the socket and go to the dentist immediately. Now, that's for teeth getting knocked out completely. But if you fall, you have a bump, you chip some teeth, right? Or even if you don't have any chipped tooth, you still go and see the dentist, because the effects of trauma may not be seen right away. It may actually come later on, and you need to go to the dentist to have it checked and full consultation.
What does an ideal daily oral care routine look like for a kindergarten age child?
The holy grail is twice a day for everyone, morning and nighttime. The most important one is the nighttime. And you brush for 2 minutes.
2 minutes.
Yes, 1 minute for the top, 1 minute for the bottom.
You know how difficult that
Yes,
is to brush
it's
a child.
very,
2 minutes standing brushing the teeth.
Yes, that's
Challenge.
right. Even 30 seconds is a challenge.
Yes.
Yeah.
That's 2 minutes of brushing the teeth. Who should do it, the child or the parents?
Both, actually.
Or both?
Yes, but under 2 years old, you can have them play with it. You always brush for them. That's a must. 2 and above, they can try it first. But usually I tell patients and parents to assist their brushing until they're 9 years old.
Oh.
It seems very old, but you only learn manual dexterity until about that age. So you need to check them.
Okay.
If you have any food stuck in between the teeth, you are only allowed to use floss. Do not use toothpick. Do not use your fingernails. Do not use cotton bud. Just use a floss. Or if not, CS.
This is for children only or for everybody? Don't
For
use
everybody, actually.
Oh, don't use toothpaste.
I don't. It's not good for you.
All right. How often should children change their toothbrush? And should it be replaced after illnesses like flu or cough or fever?
Right. The gold standard is to change at least every 3 months. or the moment when you see the shape or the bristles have gone out of shape and very, very crusty, just change it. Not every single flu that you have to change your toothbrush, but if it's a really bad one, like influenza or hand, foot, and mouth, please change it almost immediately.
This is, many parents are asking about this. What
Yes.
is mouth breathing and nose breathing? What's the difference and why does it matter for oral health?
All right, now think of your nose as air filter. It warms and cleans the air. Your nose hair actually traps all the dust. Now, mouth breathing is like leaving your front door or the gate open. Anything can go in and out without any filter. It goes straight down. So mouth breathing is really bad actually. Now, if let's say your children do a lot of mouth breathing, come see the dentist. We also need to check if there's any side effects from the mouth breathing long term, and then we can actually refer you to an ENT specialist if needed. Usually, at least we would check how big the tonsils are, if they have any obstruction at all, or any certain tongue features that they have that's preventing them from nose breathing.
Should parents be concerned if their child snores regularly?
Yes, of course. Even for adults, we shouldn't be doing that. That means there is some sort of obstruction between the nose and the throat. Anyone knows that even in children or adult, if you snore, you don't get enough oxygen. That means a poor quality of sleep. So that can look like they're very grumpy, very irritated, and they just want to sleep all the time during the day.
What does teeth grinding in children usually indicate?
There's quite a few theories to this. Now, number one is because if, let's say, they're snoring, so the teeth grinding can sort of be a smart signal for the body to wake up. They need to breathe. The other one is that when they dream, because children dream, right? And dreaming is very important for your cognitive development and memory as well. So that translates to REM sleep. Every time you have a REM sleep, your teeth can go haywire too. They can start grinding. That's one. Or when they're very, very tired, they seem like they still want to sleep even in they still want to play in their sleep. So they're going, so yeah, that's all.
Can grinding baby teeth affect permanent teeth later?
No,
No.
none at all. So you don't have to worry about that. But if it keeps going on until their teenage years, we'll find out if there's any wear and tear.
If a parent notices snoring or grinding, what assessments or treatments might a dentist recommend?
We will actually refer you to an ENT
Yeah,
or a sleep therapist.
And sleep therapy. The takeaway of this whole talk: what advice would you give parents who feel nervous about their child's first dental checkup?
Number one, never bring them when they are in pain. Yeah, never, because that will be stuck in their memory. Bring them as a happy first visit, and don't worry, we won't do any treatments on their first visit. We get them to get familiarized with us, get to know them, gain their trust. But if you do bring them for the first time and they are in pain, it's not going to be a very pleasant one. It can be quite a long-lasting trauma until adulthood. And then number two, keep it casual. If they have siblings, we do modeling behavior. The older one would go first, and then the younger one can have a look, or whichever, because I've had the younger ones who are braver than the older ones. Whatever it is, we do modeling behavior quite often. And tell, show, do most of the time. No surprises.
No surprises. What are the most important things parents should remember about caring for their children's teeth?
Number one, brush their teeth twice a day. No negotiations. I know it can be very difficult, but keep trying. The most important one is at night, brushing their teeth before they go to bed. That's the most important one. But also, if they fall asleep without brushing their teeth, do not wake them up. Just use a clean cloth and handkerchief and just wipe everything away, and then that's it. But if they do have teeth by that time, just take a smear of toothpaste on your fingertip and just put it all over. That's good enough. Number two, good diet. Don't let them have all these sweet snacks. as a habit. Treat them as desserts, as rewards. We can figure out together what smart snacking is like, healthy snacks. We are not depriving them from cakes or things like that. We just want them to know that you must have it at this time and then not do it when they're bored. It's always better to give a bar of chocolate than a pack of M&Ms because they can munch on all day. You just tell them you have to finish it now. If you don't finish it, we can have it later. Things like that. Number 3, regular visits to the dentist. Every 6 months is a very good habit to have. At least they know as they get older, it'll be easier for you to get them to go to the dentist. And it'll be easy for you as well. They will be able to tell you if they're in pain and then not leave you with not much sleep and worrying. That's it.
You were saying, so sorry, you were saying about the snacking, right? That means like children nowadays, they love to just snack in front of the TV while watching TV,
Yes.
right? And then they are constantly hungry, looking for food.
Mhm.
How do you recommend parents to handle this?
It's good to snack. It's just changing the type of snacks. It's okay to munch when they're watching something. At least we're trying to feed them. But like I said, it's the choice of snacks that you give them. Sometimes it can be quite overreaching. Some parents may not even have the access to it, but it's better to have a healthy sugar-free cookie bar, right? Cookies, rather than the processed ones.
Also, homemade ones, you mean?
Homemade ones, at least you can control. But if you can't get those, there are other options for much healthier snacks these days.
Like fruits?
Fruits, yes, fruits. Great one.
Fresh fruits.
Fresh fruits are much better than smoothies, actually.
Oh, no smoothies.
Because the reason being is that fresh fruits, they're not activated sugar. Once they bite into it, then the sugar release. But if you blend something, they taste nice. That's ready sugar. Once they get into the mouth, before they even do anything, it's already acidic.
That means you use a straw
Use
so
a
that you
straw.
don't get the smoothie all over the teeth.
Correct. But also children tend to suck it up their straw and then swish because it's fun. It's okay. You'll get there. You'll never get the first one right.
Yeah. Healthy snacking.
Yeah.
That's the end of our topic today. We would like to thank our Dr. Suraya and also remind all of you that a healthy smile starts with a small daily habit. Is there anything you want to say? A golden rule?
Come go see a dentist. Come see me, see anyone. And really, don't wait for the first toothache.
If you want to see her, she'll be in
Christine Mid Valley and Empire Subang.
Thank you. Bye.
Bye.